Hey everyone, do you know that 1 in 4 people dies in India because of cardiovascular diseases or heart diseases? And globally, 17.9 million people died in 2019 because of cardiovascular diseases. That's 32% of all the total deaths reported globally in 2019. And the shocking thing is that 85% of these deaths were due to heart attacks. And most of the deaths were due to lack of immediate treatment and lack of knowledge among the common people regarding how these cases should be dealt with. This video is not just for the medical professionals but for each and everyone to know how they should react in case they or their loved ones are suffering from a heart attack. This video is not in any way a replacement of going to the hospital. Rather, this is all about what you should do before the ambulance arrives. Hey everyone, I am Ishan, a third year medical student, and you are watching Not Just a Medico. A heart attack happens when something blocks the flow of blood to your heart, resulting in lack of oxygen to the muscles of the heart. Heart attack, also called as myocardial infarction, where myo means muscle, cardial refers to heart, and infarction means the destruction of the tissues due to lack of blood or lack of oxygen. So before knowing what to do in case of a heart attack, we need to know how to distinguish between a heart attack or a normal chest pain. Remember, not all chest pains means heart attack, but all chest pain should be given prompt attention. Now we need to understand difference between a normal chest pain and a heart attack. In case if someone is having a chest pain after a physical exertion or exercise, then there is a high chance that this is due to a stable angina. This is very different from heart attack. In stable angina, the blood flow to the heart is reduced due to narrowing of the blood vessels, but it is not completely blocked. Whereas in case of heart attack, the blood vessels to the heart gets completely blocked, resulting in total lack of blood and lack of oxygen required for the proper functioning of the heart. Now, we have distinguished between a case of stable angina and a heart attack. But how we can understand apparently by looking at the patient. In case the pain subsides or goes away with a small amount of rest, or by taking a pill of nitroglycerin underneath your tongue or sublingually, then this is a case of a stable angina. You need not be too much worried about. But in case the pain does not get away, even after taking a pill of nitroglycerin, then you should understand that this may progress to a heart attack, and this case should be dealt with immediately. So, how to deal with a case of heart attack? Firstly, if you are suspecting that this is a case of heart attack, then it is best to call the ambulance immediately, because this is a case which can be best dealt in the hospital by opening the blockage of the heart. But before the ambulance arrives, you need to do certain things which can enhance the survival or the rate of survival of the patient. Firstly, make the patient sit down. Ensure that he or she is comfortable. Loosen their clothes so that they can breathe properly. It's recommended that you make them sit on the floor so that there is less chance of injury in case he or she collapses. Next, while you are waiting for the ambulance, ask them to chew a pill of aspirin. It should be present in everyone's home. This aspirin inhibits the clot formation, and hence it can increase the chances of survival significantly and can increase the chances of survival by almost 25%. Next, you should reassure the patient that he or she is going to be all right until and unless the ambulance arrives. You need to assure the patient the entire time that he or she is going to be fine very soon. These are all the steps which you should do before the ambulance arrives. There is not much you can do at home because this is a case which can be dealt in the hospital properly. But before the ambulance arrives, you need to keep these all points in mind, and this might increase the chances of survival significantly. But how can you understand that this patient is having a heart attack by looking at the symptoms? A classical set of symptoms includes breathlessness, discomfort, and a tight pain across the chest. Some patients have even reported that they felt like an elephant is sitting on their chest. Some has reported that they feels like they're wearing a tight band across their chest. So these are all the symptoms, and in most of the cases, the pain goes up from the chest to the jaws and radiates to the arms. There can be pain in the lower back and also in the upper abdomen. All these pains, all these cases, you should understand that these are pointing to a case of heart attack, and you should do all the steps you need to do before the ambulance arrives. Now, I would like to talk about how you can prevent these heart attacks, because you all know that prevention is better than cure. And this is a case which is very much controllable to a large extent, until there is some genetic problem, like it can be inherited genetically. But the factors which we can control on our own includes, we can do regular exercise, and exercising can reduce the risk of a heart attack significantly. Just 30 minutes of exercise 5 days a week can reduce the chances of a heart attack significantly. Next, if someone is smoking, it's better to stop smoking, because smoking increases the chances of a heart attack dramatically, and not just heart attack, it can lead to several other cardiovascular diseases. Next, you should do a regular check of your cholesterol levels, because a high cholesterol indicates that there is a higher chance of a heart attack, and you should visit the doctor as soon as possible. Next, you should limit the alcohol intake, because if the intake of alcohol causes more fat deposition, which can increase the chances of blockage in the arteries, which can lead to a heart attack. So if you don't drink, don't start. But if you do drink, then limit your drink as far as possible. And the most important thing is that you should cut back on the unhealthy foods. Try to take whole foods like fruits and vegetables, and cut back on foods that are high in salt and sugar content, because not just this foods causes heart attack, but also increases the chances of several cardiovascular diseases and also hypertension or high blood pressure. Remember, a heart attack can lead to a cardiac arrest. In cardiac arrest, there is complete stoppage of the beating of the heart, and the patient will collapse, become unresponsive, and the patient will stop breathing. In case a heart attack has progressed to a cardiac arrest, then the person needs immediate help. In case the person has stopped breathing, or even if the person is gasping, then we need to start CPR after checking the pulse. If there is no pulse for more than 10 seconds, then perform 5 cycles of chest compressions or CPR, or if there is a defibrillator or an AED device available, you need to perform the defibrillation. And don't worry, I will make separate videos on how to perform CPR and how to use an AED. Always remember that the best time to start treatment of a heart attack is between 1 to 2 hours after the first signs of symptoms appears. This is called a golden period. The longer you wait, the more harm you are doing to your heart, and it can reduce the chances of survival. Also keep in mind that heart attack signs are different from one person to another. Chest pain is the most common form of symptom, But in case of women and in case of patients of diabetes, there can be some other symptoms. But there can also be no symptoms. Yes. That's all for this video. See you in the next one. Till then, take care.